The toes are essential for appropriate gait, right? If the toes aren't working good, and it's going to affect the ankle. So, can you lift the toes up? That would be extension of the toes. So now we're in, there's going to be sagittal plane based movements we're starting to talk about, and they're all going to be flexions or extensions. They're going to be movements that would be related to moving you either forward or backward, right? They're all going to end up being labeled flexion or extension. So if we lift our toes up, that's extension of my toes. Cool. I can lift apparently my left big toe more than my right. That might tell me something, right? Curling the toes, that would just feel like you're gripping the floor. Usually people need more help in extension and they're too strong in flexion. That's going to be a more common pattern for people. Showing a little bit of a thing here is, can you keep your little toes down and lift just your big toe? Can you push your big toe down and lift just your little toes? Might be difficult one foot versus the other, right? And kind of just right now feeling like now that's extension of one, flexion of the other. So if I lift my big toe, I've done extension of that big toe. I'm activating extensor hallucis longus, but the little toes, I'm activating like flexor digitorum longus. And we flip that, activating the flexors of the toe and the extensors of the other toes. Okay, cool. There's some basic toe stuff. There's also abduction and adduction. If you can, I can't show that too much. I'm better on one foot a bit than the other, but that's where you'll hear people talk about spreading the toes, bringing them back together. Usually people need help. Again, we're going to be too strong usually in flexion and adduction. And this is going to be a universal thing we see in most areas of the body, that the flexors and the adductors are bigger and more powerful, and are the ones that fight gravity more. So they tend to get too strong, get too short, and the extensors will tend to be too long, too weak. So these are my feet, they tend to be too flexed and a little bit too adducted, like everything's stuck together. So if I have a pattern I try to think about is freeing those up. The muscles that do that are in between, okay? For adduction, abduction, I gotta keep myself more on task. But you see those red lines in between these long tendons? Those are related to here's your digits. But you can't see this, right? So I've removed this and we're talking about the palm. Most of the palm and the foot are these metacarpals and metatarsals, and there's muscles in between those. That's why I talk about the bending each one back and forth. That's how to free that up. Okay. Now for flexion and extension of the knee, we have a couple, ankle. Toes, I'm on track. Landing a plane, right? All right. Ankles. What are the actions of an ankle in the sagittal plane? I'm sticking with sagittal plane. We can do dorsiflexion, which is going to be lifting. And you're going to feel your toes pick up at the same time. Those actions work together. Your toe extensors and the dorsiflexors of the ankles are paired. Right? Now, I can compare, either you're watching me or you're feeling yourself, which one of those feels harder or easier. So dorsiflexion. Now, for plantar flexion, if your balance is great, sure, you can do this kind of stuff. But if you're being more cautious with the client, have them stagger their stance and then just do a push-off like this. You get a couple of things with this. If a person's going to do this, it's different than, because I could just have them pick up their leg and do that. That would be more isolating of just the ankle, right? So I could just have a person do that. Here, ankle down to plantar flexion, so plant on the gas pedal, plantar flexion, dorsiflexion. If I'm standing in gravity and I do a push-off, my toes have to do what as I go into plantar flexion? the toes have to allow for extension. And then suddenly there's a switch that has to be flipped where the toes help push off, but then we gotta go back into extension. It's a whole kooky thing. Important that the toes are able to flex and extend because that'll affect your ankle's ability to dorsiflex. And more precisely, when we get to gait, to plantar flex. My toes can't allow for that extension. I'm never gonna get to this point where I can actually lift my foot off appropriately, and I'll end up with some kind of warped gait. All right, plantar flexion, dorsiflexion. Again, dorsiflexion, plantar flexion. Knees, we have a couple options there. If somebody's balance is good, but like anything with this stuff, if you're gonna have people do anything single leg, have them hold on to something. Don't trust your clients with their balance. There's a wall, there's a chair, there's a table. They could hold and do this stuff for you if you want to do it that way. So, I'm trusting everybody here seems totally fine. All right, now the first one here could be just this. But we're getting hip and knee at the same time when we do that, right? So we're not just isolating the knee. And what we're looking for here in this action would be 90 to 90. That would be ideal. If we want to get more precise with just the knee, and this one will usually be real different. So everybody feel the freedom you have doing this. You're like, yeah, my knee is great. There's nothing wrong. And then the couch will get you. Or there's this one. Keep your knees here. Don't flex your hips. So don't do this with your hip. Hips stay fixed. I should have said hips stay fixed. And just bend the knee. That's just knee flexion. So knee flexion. And you should be able to see, I'm going to exaggerate mine a little bit. Right one, I think I'm getting a little bit past 90. Yeah. Left one, being honest, it wants to stop about there. And it feels heavier, feels harder to do.
What if you can go past 90?
That's brilliant. Okay. We know this, you have a tendency towards a little bit of hypermobility, right? But no, that's great. You should be happy about that. Okay. Now, if I force it, yeah, I can take my heel straight to my butt, but we're looking at this region. Now, what would this tell me? Right knee feels pretty free and easy. Left knee feels harder to do. What's actually short and not allowing that action? It's here. They're holding the up. So, and it'll present as issues usually more anterior with the knee. Like a patellar tendonitis, somebody tries to do these actions, they're limited in knee flexion because the knee extensors are too short. So regionally, you can rely on the extensors of the knee or on the anterior upper leg. The flexors of the knee are on the posterior upper and lower leg. But here, you'll see that this calf muscle, this big calf muscle, gastrocnemius, crosses the knee. So it and the hamstrings are involved with, when they concentrically shorten, they cause knee flexion. But in order for that to occur, the stuff on the opposite side has to lengthen appropriately. There's always going to be this agonist-antagonist relationship. Typically, we're talking about agonists relative to them being a prime mover related to a function, which is further going to usually correlate with concentric shortening. So if I do knee flexion, my agonist would be, my concentrically shortening muscles would be the flexors, hamstrings and gastrocnemius. The antagonists would be the anterior knee extensors, quadriceps group, right? With the ankle, I missed that one a little bit, but it's not too bad. Guess where the dorsiflexors are? Wow. Guess where the toe extensors are? Wow. Guess where the plantar flexors are? Wow. Achilles tendon muscles versus the other ones that I've talked ad nauseum about. So So we have these big ones that become the Achilles tendon, but then there's other muscles underneath that go into the arch of your foot, through the bottom of your foot to your toes. So, like tibialis posterior stops right there. I'll talk more about those when we get to frontal plane, but it's weird in that we don't have down here like compartments so much on the side. There's like a deep one and a superficial one. Over here we have a anterior one and a lateral one. And so there's some cases where it's like we don't have muscles on all sides of our body, but it doesn't mean there aren't muscles that move us in all directions. Yeah, does that almost make sense? Okay. And I'm going to leave that there. Hip flexors and extensors. Not too bad. Hip flexion. Or it could be. But the weight of the leg then is involved. So this is an appropriate test to just kind of figure out hip flexion. Hip flexion, hip. Now, coming a little bit back to flush, something I forgot to really kick us into is anatomical position. You're already in extension. We're starting at 0 degrees here. The movements out of this, going in the sagittal plane, these moving forward like this, are going to be all flexions. So whether it be a seated position, I don't need to do that, but like a squat, the thing that's unique here is not the ankle, but everything else, knees, hips, everything. If I curl up like a baby, go into a squat, just like that, fetal position, that's all my flexors. We're moving in the sagittal plane, we're moving out of anatomical position into flexion. So I have gone to 90 degrees, I've gone from 0 degrees to 90 degrees of hip flexion, 90 degrees of knee flexion, but then I'm going to return, so I'm going to go from 90 degrees of flexion to 0 degrees again. And that would be going into the extension phase. Okay, so flexions, extensions. Then we can think about hyperextension. At the hip and the shoulder, this is going to matter. And for some reason, it doesn't get talked about relative to this term enough. You will hear many practitioners call this extension. It's not. You're already in extension. This would be hyperextension. And so you should have hyperextension in the spine and the shoulders to allow for, guess what? Walking, right? So about 15-ish degrees. I'll come back around to this as kind of a basic little formula. We discussed a little bit, but like flexions and extensions, you should be able to move into at least 90 degrees and then return back to 0 degrees. Abductions and adductions, 45, rotations, 45, but here, about hyperextensions, it'll be 15. So I can at least get my leg behind me to do this push-off face thing. If I can't do that, then I'm stuck. But even that would be really hard because as one leg moves forward, one's behind me now, right? So we need that little bit of hyperextension. All right, now if we load everything, it's a little bit different, but we can also look at these functions all together, where somebody's just standing, they're usually not going to stand with palms forward, but we could take a step forward. That's going to start as hip flexion. Then as we heel strike, now we're doing dorsiflexion of the ankle. Just to simplify things, I'm not going to worry as much about toes right now. Dorsiflexion of the ankle, flexion of the hip, heel strike. Then as I flatten my foot out, my knee goes into flexion. Now this is your stance for massage, right? That's not gait though, is it? But here we are. And can I efficiently just take this step, do a controlled heel strike, transfer my weight more or less to that front foot, not lifting my heel. And I transfer my weight to that front foot, and then come back out of that. When you slow these things down, heard a pop?
Yeah, sorry.
When you slow these things down, you can just try to pick up, and initially all I look for, did it look smooth? Did it look easy? Right? And then comparing the other side. Get their input. Does one leg feel different than the other? Initially, you'll be thinking about the one that you're moving forward and shifting your weight to, but it's also just as important to be thinking about the one behind you too, right? If this hip is too short, then I try to do this, and this will all get disrupted. This knee will stay flexed, that heel might lift off. So it might end up looking like this, an exaggeration. So, that's a normal transfer. Now you could flip that and go, well, all right, let's flip it around and take a step behind us. It actually is a different action, right? It doesn't feel the same. Or to change up how the camera is viewing it, it might look similar if I were to just go back and forth. But taking a step forward is different than taking a step backward. But the transfer of mechanics and all these points being interdependent is not going to shift too much. If everything's loaded in what's called a closed chain means they're just stacked. So this comes back onto kinetic chain stuff. I can't stand on both my feet and bend my knees without it also affecting my ankles, right? I can't bend my knees and keep my eyes level with the horizon without it affecting my ankles and my hips. I keep the spine pretty neutral. That's what we want. When we come to spine-based movements and core-based stuff, that's the thing I want to try to reinforce, is that the muscles directly of the spine really should be more about stabilization. It's your limbs that are about your movement and locomotion, right? Now that involves the pelvis and the scapulas, but when we walk and move around, the spine should be pretty neutral, right? There's a lot of structures, even the neck, that kind of allow for some minor rotation, but there's like ligaments back here. Everything's about really keeping the spine here, while the limbs, including the appendages, including the pelvis and the scapulas, move everything around, right? So, when it's stacked on top of each other, that's where all this like interdependence can occur. And if somebody has a tendency, when we get to gait, of bearing more weight on one side than the other, then you could see how that effect could be more extreme on that dominant side of their body, right? Now, coming to the spine, so we talked about hips. The only thing you missed was the hyperextension. You need to have some 15 degrees. I'll come back around. So flexions and extensions of the spine, and be a little bit careful with your spines. Don't be going to extreme things just to show off or anything. But standing, one thing is, now this is a bit for longevity, and this comes into some things that are just good for you long term, for related to core stability. Everybody's at least in the know on that, right? But it's being able to, feels like you're tucking the pelvis, but what you're doing is taking the spine from hyperextension into flexion. So 0 degrees for me would be about here. But if I exaggerate it, then it's going to feel like I'm either kicking my butt out, or I got to kind of do both at the same time. So the postures can be that. If somebody has their knees at full extension, then it'll look like their tuchus is really out there, right? But if both are involved, then it'll be kind of more like trapped in this bit of a squat. That would be similar to what you might see in like a bow or knock-knee varus valgus kind of thing, where everything kind of has to drop down together. But what has to happen at the spine, keep you level here, I got to take my spine into hyperextension. Now, what's better for the spine, I promise you, is to be a bit more in flexion, to flatten out that arch a little bit. So from here, that's why you need the knees unlocked a little bit, being able to just curl. And it should feel like I can make that more or less flat. Being able to control that action, we're still in the sagittal plane. This is extension of the lumbar spine, flexion of the lumbar spine. And these actions may seem similar to ones you would see in yoga and other movement pattern ones. But really important to be able to go from here to here, cat, cow, right? Same thing, really essential to be able to get here. The muscles I feel activate in order to pull that off, glutes, lower obliques. Now we can go a step further with that and just have a person look like bow back, minimum about 15 degrees, but we're looking at the low back, although they're gonna wanna look at the ceiling. We could get two things at once. If I do this, I have cervical spine and lumbar spine working together, right? And these are like functional related activities that can be important. Can a person at least look at the ceiling without feeling pain? That's an important functional thing to be able to do, right? Is the ball coming at me or not? Right? But you need both in order to do it well. If your low back can't do that, then your neck is gonna have a harder time, right? If your neck can't do that, your low back's gonna have a harder time. So, flexion-based patterns, not being able to get to the floor. And this is the one where, like, loosen yourself up, do a few of these. Always, the warm-up construct is essential with stuff. You know, the body needs to be primed, just like a lawnmower with oil, right? So we do better doing lower intensity, slower motions before we do the fast, big motions with more intensity or more weight. So just walking or going through these systems of action. This was the warm-up routine we did in the NBA. Da 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 da, ha ha, ha ha. Then we would amp it up and it would be ha, 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 ha. It would be all of that, and it was just low intensity movements through range, through planes prior to going into full practice. What an idea, right? So, now being able to reach, let's see how good I am. My hamstrings have been awfully tight lately, so we'll see. As I go forward, I do not want to be doing, we're going to talk about hips first before low back. The ideal reaching for the floor action is to not that. And when you come back up, that's the danger zone. Getting to here isn't going to usually hurt anybody. It's trying to get out of that, right? So ideally when a person does this, what's happening is at the hips. It's hip flexion. And then what you're going to look for, with me right now at least, is how much of an arc do you see in my low back? Do I look really rounded like this? Yeah, there's a big bow. Versus, I can still do it, right? More flat. Is that more flat? So I can kind of get there. If I go through a few cycles, it gets better, right? So we'll return to why you'll see movement systems that basically have you reach for the floor, come back out of it, and keep reaching for the floor, and come back out of it, and again, and ideally be able to have palms on the floor with your heels down, the downward dog stuff, why all that exists. Why it's worked so well for humans, right? Because it's training the ability for the hips to accomplish that motion. But downward dog is an example. In order to do it right, you have to have ankle mobility, right? Yeah. So, everybody feel that in yourself? Reach for your toes and see where you're at. Don't fight through it, except that it's the morning, it's cold, you're gonna be stiffer. I don't see anybody too horribly rounded. Yeah.
We're just naturally trying to reach.
Yep, but don't
not
push.
Thinking rounded or flat.
Yep, just natural reach. Andrew gets to be the show off.
Andrew,
He's got the
really
best mobility
arms.
of us all. He's certainly paid attention to it, but would you mind doing that for everybody again?
Sure.
He right now I think has our best range
Wow.
of being able to really get there. So
That's impressive.
if you saw that, you would say, hey, that's really good. Now you had a low back thing, so I'm sure that you've been really good about how to modulate the action, because it would feel bad if you didn't do it right.
Yeah.
So that's a bravo. But you won't see that all the time. You're gonna see a lot of right? And that's where you gotta identify what's the issue here. It could be the hips. It's a little bit, is it the hips or the low back? In order to perform these actions, the two are very interdependent. Being able to go forward and come back up. And that includes actions like sitting down and standing back up. Sitting down, back up. Flexion. flexion and flexion, extension and extension, right? So you could have a person just do that, but this can be valuable. See where they're at. Sidebar on hamstring stretches, okay? Lots of people like to just do I'm not a fan. It works okay, but I have a better one for you. It's gonna be more connective tissue, fascia release stuff, right? If we set ourselves up, and this kind of helps you gauge your own body, hands on the tops of our pelvis. That's gonna tell you what your low back's up to. If that starts curling this way or tipping that way, you know your low back's doing something. So you get yourself in like good posture, hands on pelvis so you know what your lumbar spine is up to, okay? Kick forward, knees straight, ankle dorsiflexed. Now you're gonna have to, you might feel like you have to increase some, the stability here might be a bit much, so if you have to, you can always do it like this. But you have to bend this knee, and then you just tip forward with your whole body. Keep your low back straight. Should be able to find a pretty good posterior leg stretch somewhere in there.
All the way to the calf.
Feels good.
Yeah.
Yes. So isn't that maybe a better stretch than?
Yeah.
Yeah.
Okay.
I would think that puts a lot of pressure on the knee.
Yes.
The wrong way.
Yes. So it is this.
Yeah.
I'm not a fan. Okay, because it takes them to end range to facilitate the stretch. This loads multiple parts of the chain, so we're getting more of a broad spectrum myofascial stretch that is safer, but it's related to getting everything from the hip all the way to the calf, right? The anterior stretch is a little bit tougher. There's ones where you can kind of stagger like this. So I have to exaggerate the hyperextension of the hip, be aware of what your lumbar spine is up to, bend the knee, but then try to curl that pelvis like that Tai Chi thing I was showing. It's here, here. Now, if you already have plenty of mobility here, it's gonna feel maybe difficult. For a lot of people, it feels like they can't get a stretch here doing this. So the next part would be usually something with like a hook on the back of it. The challenge is the stability part of this. We had stretching stations, you might see like stretching cages, where people can have bars in front of them and bars behind them, right? But the best stretch for the hip is being able to just get your leg behind you in such a way where the ankle is supported. If I had like a bar, I'd want it right at my ankle, and then I can play with. Now I'll find the stretch more easily. You have to be careful with your low back. People will do this. You gotta kind of stay on this leg. Try to drop that in here. We can do variations on this on the table by having the leg off the end of the side of the table too. But when standing in gravity, table, back of a chair, stuff like that, the factor is when we're showing this stuff for our future clients, balance, right? So balance will be more about frontal plane. We'll come back around to balance. But balance, single leg stability is super essential, all right? Okay. Working our way up the chain, let's just go from our ankles now to our wrists. So fingers, this isn't hard. Flexion, extension. Cool. Okay, wrist, flexion, extension. Not named weird like the ankles. The ankles are named weird because when loaded in gravity, I go into this flexion pattern, they go into dorsiflexion, which from a functional standpoint is usually more paired with extension, but when we're loaded with both legs down, it's different. So they gave it a different name. So they're both flexions. Dorsiflexion, plantar flexion. Although the way I think about it is dorsiflexion is a bit more tied in with extension, and plantar flexion is a bit more tied in with flexion. But wrists, hey, cool. Flexion, extension. Elbows. Wow. Shoulders. Let's do two renditions of the shoulder, one just to 90. So now this anatomical position, most of the time that is not the natural orientation for people. So if we're going to do shoulder-based movements, and this isn't perfect, but it's pretty good, rule of thumb, where your thumb is pointed usually aligns the bones of your shoulder effectively for better movement. So thumbs for sagittal plane movement, thumbs forward, that will be where you have less likelihood of there being something offset with the humerus and the glenohumeral joint. If I have somebody like this and they try to do that, could be a bad time. They're like this and they try to do that, could be a bad time. So shoulder stuff, rule of thumb, will usually keep you protected where you have everything lined up in the right direction. So at least to 90 degrees. That's for the ball and socket part of the joint. The pelvis is fixed. The scapula is not, right? So there's going to be less range, seeming range here at the hip to pretty much only needing 90 and a little bit more, but the pelvis stays, right? The pelvis is loose for like somebody that's super hypermobile, then that can be where some of the extra range is happening, but the scapula is where the extra part of the range is occurring. Scapular movement starts even lower, but you can simplify this down to shoulder movements to 90 degrees in this and in frontal plane are about the ball and socket joint. They're about the glenohumeral joint mostly. Beyond that, it's scapula. So for example, what is my actual problem? Is it my rotator cuff, ball and socket joints, the glenohumeral joint? No, I can do this just fine, right? Turns into exercise if I do this enough. Where my limitations are is beyond that 90 degrees, trying to get to the 180. So it's another 90 degrees at the shoulders, 90, and then another 90 for an ideal range. So you look at me, not getting to 90, right? Here, 90, not getting to 90. But everybody else, I think, 90. Yep, good. But not bad. Related to neck stuff,
Yeah.
it's not going to be any different than me talking about why the back to the hips, lower the chain is so important. But you're not going to have a neck thing, and I've had my neck stuff. It all gets tied together. So you're not going to have a neck thing without affecting the shoulders. You're not going to have a shoulder thing without affecting the neck. You're not going to have a low back thing without affecting the hips. You're not going to have a hip thing without affecting the low back. Blah. All right. So 90, 90, a little bit extra, right? We need this. Got to reach behind you a little bit. Go, right? So you got to be able to have at least at 15 degrees. And it's not about like some kind of extreme action. Think about like walking upstairs and walking. I need that little extra bit of hyperextension